Africa uses 25% of vaccines produced globally, yet only manufactures 1%. The continent waited months before it could access vaccines during the COVID-19 pandemic. This forced the African Union and the Africa Centre for Disease Control to develop a plan to support local manufacturing. A new African biotech startup, Afrigen, is changing this narrative and now producing vaccines for the continent.
We are currently standing in the research and development laboratories where we are developing the mRNA vaccine, firstly for COVID as a model vaccine, and then we also have a few other mRNA vaccines in the pipeline.
It's not been easy for African vaccine manufacturers, but with the support of the African Union and WHO, Afrigen is now one of a handful of African local entities producing made-in-Africa mRNA vaccines.
So I think, again, Mpox is going to bring the energy and the impetus and the realization how important it is to make sure that we succeed in the goals that we've set for this continent. In addition, is there an initiative to look at the innovation side of Mpox vaccines? Can we improve on the current vaccines? Can we make sure that a new vaccine will protect against the different clades, the different variants?
There's been several Mpox cases reported in South Africa, and local doctors say education is key.
Lesson number one, in terms of just being vigilant, is us as GPs, and I belong on little social media groups, WhatsApp groups, Instagram groups with fellow doctors. We send alerts out to each other, educating ourselves on signs and symptoms, what to look out for, and we get many notifications from the NICD, which is the National Institute of Communicable Diseases.
South Africa's health ministry said it agreed with the World Health Organization decision that because of the scarcity of the Mpox vaccines, it had to prioritize countries like the DRC. Health authorities indicated that they are awaiting a couple thousand doses that will be for very high-risk patients. Health experts say the lack of access to vaccines in Africa not only poses a threat to the continent's public health, but also hinders its ability to effectively respond to the global health crisis. Crystal Orderson, TRT World, Cape Town.